Muller coming to you from the Combat Center at 29 Palms. And the Sergeant Major and I decided to come back to this Facebook Live event based on some really good feedback we got last time and a lot of really good questions that came from the community. And we wanted to come here again today to talk about where we are on the COVID-19 response here on the installation, and also what we're doing to maintain combat readiness of the force and keep our combat edge sharp. As you know, we've been putting out daily information, so what we do on the Facebook page, Make the Stumps Better, we've been putting out almost daily updates. Those updates are completely transparent. We're communicating with the local commands, and then we're also pushing out pretty much the same information on the Make the Stumps Better daily to keep you all abreast of the situation. The situation continues to rapidly evolve, and our actions that we're taking are completely informed by the guidance that we get from higher headquarters and also our local health professionals who are really plugged into the local and state response, and then we're trying to make sure that we stay completely in step with all that. But the situation has been changing rapidly over the last week, and we're staying abreast of that and really focused on taking care of our Marine sailors, soldiers, and family members aboard the installation. I'm going to now pass it over to the Sergeant Major to add a few comments, and then we'll proceed.
All right, thank you, sir. Good afternoon, everyone. I want to say a quick three things. First and foremost, our number one priority here is the safety of the Marines and sailors and civilians aboard the installations. We still have a mission to be most ready when the nation is least ready, and that's most important right now. And then just to remind everyone to follow their current chain of commands guidance, because that guidance will be coming down from the highest levels through the commanding general down to their chain of command. Thanks.
All right, hey, the next thing I'd like just to thank really all of our health professionals here. We're really joined at the hip here with the Bush Naval Hospital. And so I'm meeting with the hospital commander daily as we work together with our Navy counterparts to address this aboard the installation. And we also have a really professional public health staff that's part of the hospital that really specializes in preventive medicine and the spread of disease. And they have been giving us some really great advice as we work through this. I'd also like to thank all of our base employees that really are focused on the essential services aboard the installation, our MCCS, our commissary employees, the military police and the like that keep us safe and keep the lights on and keep everything operating aboard the base. As you all know, many of those folks don't have an option to telework or reduce. They're still at an even higher operational tempo than they normally are. Okay, just to update a few things as of today. So thus far in the process here, we have tested 37 people aboard the installation for COVID, and thus far 30 of those have come back negative. We have 7 that were tested yesterday that are still pending. However, as we look, and it was in my update last night, one of the things that's concerning us is there is pretty significant person-to-person transmission of the disease in Los Angeles and in San Diego counties. And that's adhere to the strict social distancing, and then wash your hands frequently, and then don't touch your face with unclean hands. And those are the things that everybody needs to do to prevent the transmission and break the cycle, especially the person-to-person transmission that we're seeing take place in the local area. And then, based on those facts, we've had to further restrict the visitor requirements for folks coming on base. We put that in place last night. I know that that creates some hardship for folks that might have had visitors planned, but we're going to have to restrict that. So the visitors are going to be screened, and then they're going to have to be essential visitors only. which we define to the commands, and then we have a process for being able to approve those folks to come aboard the base pending their passing of the screening. But I would just ask everybody, this is not the time to have your friends, your friends and family to come up here to the Combat Center to visit you from far afield or even from the local area based on this crisis. And we really have I have an obligation to protect our population here and to protect the mission, and that's what we're focused on doing. As been noted on a couple of the updates over the weekend and the like, is that I'm concerned that we don't have the full population taking this as seriously as we need to. I did see a lot of people and a lot of units that are exercising some good factors as far as social distancing and other measures, but then we still have a number of people aboard the base that just don't seem to get the message. So we're working on education on that, and we're also going to increase enforcement of that throughout the days ahead. I'm just going to cover two additional quick points, miscellaneous information, and then we'll get into the questions. So as you know, we did have to shut down a number of our MCCS activities. But I will say that our counseling services and our Marine and family programs are still intact. They're just going to be available telephonically. So if you're involved in services or you need additional services for you or your family, please work via the phone to still have access to those services. And then the next update will be is at the Child Development Center. We're going to start to screen both the staff and the children each day, including temperature checks, to make sure that we're doing everything we can to prevent the transmission of disease in that area. So now what we're going to do is we're going to kind of move into the pre-submitted questions first. So we'll answer those, and then we're going to get into we'll get into a couple of the live questions. And then if you have a live question that's out there and we just don't have time to get to it, my staff and I will kind of go through and follow this up. So just check back on this live feed and we should be able to get to these questions if we don't have time to get to them today. So I'm gonna go to the first one here. So we had a question from Valerie, I think it's Valerie Justin Paul. And she asked about Marines and sailors returning from deployment. And what are the current procedures set in place so far as quarantine goes? Will the quarantine prior to returning be on base, self-quarantine in homes and the like? So let me attempt to tackle that. So right now I know we have a number of units that are either getting ready to deploy or getting ready to come home. And that's clearly a period of significant anxiety for the Marines and families. So right now, all of the deployments and redeployments are frozen, and we are pending guidance coming from the Department of Defense on when that's going to resume. That also, exactly what those return and reunion procedures are going to be, and also pre-deployment procedures are going to be, that's still going to be forthcoming. And if conjecture is going to be, is I think it's going to be different based on where the units are coming from and where are they going to. So we'll pass more information on that as we find it out, and but that's the current status of that, and we're carefully following this because we know some folks have been deployed for a while and they're due back aboard the Combat Center, and we'll be following this as close as we can. So go ahead, Sergeant Major.
So Amanda McKenzie, she had a question, great question. Why hasn't the base gone to maximum telework for every position that can do their job safer from home with their computer, email, or phone? So we here at the base, we're encouraging telework for all positions that can support working from home. But ultimately that decision, it lies with the chain of command, whether it be civilian or service members' chain of command or their direct supervisor. If there are concerns or suggestions, please discuss them with the supervisors, and they will answer those questions. But we here at the base are encouraging as much telework as possible. But everyone just has to understand, there are some jobs out there that cannot be teleworked.
Okay, next question we had was from Southern Glover asking about are there plans to test frontline personnel like PMO, commissary, and ensure they're negative. So so at this point, we don't have any plans to test folks that are asymptomatic, other than the CDC that I mentioned, where we have some specifics there. But if people have risk factors where they've come in contact with a known COVID, or they suspect they have symptoms, they should report to their medical professionals. And in the judgment of the medical team and the providers themselves, if they decide that they're going to, first they're going to screen you, and then if they decide that they need to, they're going to test you, and those protocols are in place. Next, Kaylee, it looks like Kaylee Gray had a question about training like the McCree. This is the Marine Corps Combat Readiness Evaluation. And is this essential? And do we need to be able to practice social distancing in the field? So that's a really good question. And so there are going to be essential training events that are going to take place aboard the Combat Center and in other locations. And so we're following that closely. We're working with all the units to make sure that the procedures they are using, to the greatest extent possible, implement the guidance of the CDC, while at the same time allowing us to balance our ability to maintain our combat edge. So we're going to focus closely on that, and so we're working with the units aboard the installation to be able to execute certain training events within the guidance we've been provided to maintain our combat edge and then protect the force at the same time. Let's see. Okay, we're on the next page here. So these next two questions are very similar, so I'm going to answer them both. So this is both Kim McGowan and then Sarah Tellefson. Ask questions about our check-in and check-out procedures aboard the installation. Now, this is a great question, and we hadn't thought of this, and so thank you, too, for bringing this up, because so we're going to implement, just based on these questions, we're going to modify our check-in and check-out procedures. So as we've discussed before, I mean, we're still going to be joining people to the commands here, and then folks are still going to be getting out. So we do have certain essential items that are on our check-in and check-out sheets. But to the point of both of these ladies that made these comments, there are certain things on that are non-essential and are just creating additional contact with folks that is unnecessary. So we're going to fix this as soon as possible. So thank you for bringing that up, because that was one that we just hadn't thought of. So really great input from you guys out there. And then next, Steve Raines asked about that. Units are not really, not all the units have been social distancing as effectively as they need to, like tight formations and gathering and exchange and other places. And so Steve, I mean, you're really, you're seeing the same thing I'm seeing, and we've been heavily reinforcing this with the commanders and the sergeant majors aboard the base, and then also on our social media platforms and the like, is that we've got to exercise this. All of the procedures are for naught if there are folks that are not exercising them. So we've been working closely with the units to make sure that they've got good procedures, and we're going to enforce those procedures with the commands and also our law enforcement activities to ensure that we're executing the protocols that we're putting in place. So thank you for that question, and you're really you're seeing the same thing we're seeing, and we're trying to make sure we get this across the goal line. So thank you for that.
Michelle Orrick had a question, great question. Can you tell us to what extent, if any, that mail delivery to the base will be affected? As of right now, we have no anticipated change in the delivery of mail. Mail will continue to be delivered to the families and the students over at McCess. So it shouldn't slow down, the mail. What we do ask, though, is when you do go over to the post office, you use the washing of the hands or the usage of the Purell, and just make sure that when you're touching things in there that we're keeping it sanitary in there, because that does have a lot of traffic in there. And then the next question is from Sherry Bernal. Another great question. Has there been any discussion about rationing fairly at the commissary for the families? For an example, for families that have large families, because there are, families out there that have, 4, 5, 6 family members that live in their house. So what we're doing right now is we're going to work with DECA, the commissary leadership over there, and see if we can go about implementing something to that effect. So once we talk to them and we get more information, we'll either put that out. The CG will put that out in on this platform or out through another means of social media. But we are looking into that. And then the next question is from Catherine Myers, and this question was asked. It's been asked numerous times. How this is affecting PCS moving. So right now, all PCS orders are on hold. So until MNRA, Higher Headquarters Marine Corps makes a change to that, they are on hold. Other services have other ways they can do things, but we won't. We don't have the ability to do that. So your orders will be on hold until this is lifted, and then then they will decide on. They will rack and stack on, what orders need to be implemented first, second, and so on. But that's a higher headquarters question or answer that's going to have to be given through MNRA. And it's also been mentioned we are asking for people that are displaced right now that have PCS or that have not PCS but checked out of housing. And they're living in wherever they're living. It's been being asked up to higher headquarters to be able to put them on per diem. So we're still waiting on answers for that as well. Because I know Marines and sailors and all service are coming out of pocket right now because they may have vacated housing and now they're living in a hotel or whatever the case may be. And I do have one update from last week's Facebook. So as of now, all PME classes have been postponed. So all sergeant's course, staff sergeant, gunnery sergeant, senior enlisted PME, all of that has been put on postponement right now till further notice.
Okay, so I'm going to the live questions now, and as it's scrolling through here, I'm trying to keep up. But a couple of let me answer 2 right away, and then I'll have the Sergeant Major look for the next one. So somebody asked a question about about our response, and do we have the ability on the installation to contain the response here? And that's a really important question. So we're working really closely with the hospital to posture ourselves for the population that's aboard the base, and that really is our focus. So we're looking at expanding some of our facilities to create room if we have to isolate folks and treat folks and alike. And then we're working closely with the units that are aboard the base that also have medical personnel. And so really the relationship between the units on the base that have medical personnel themselves and our hospital to work together closely so that we can deal with the situation that's on base. So we're ready to receive patients, when and if we get them. However, though, we need to execute the protocols. Otherwise, we could even overwhelm our capability here on the base. So that's why we're enforcing all this stuff as strictly as we are, because if we don't exercise social distancing and we don't exercise the hand washing, and we have people that are sloppy and they're touching their face and things like that, or people that are symptomatic that continue to work and continue to expose people, we could easily overwhelm even our capability here on base, which is significant. And so that's why we're taking this as serious as we can, because we have a response and we're ready, but we could overwhelm ourselves here if we don't exercise this as strictly as we need to. And then the next question I'll take before the Sergeant Major goes to the next one is somebody asked a question about integrated training exercise 3 TAC 20. Right now that exercise has been canceled. So that is new news as of yesterday. So we will based on that, we won't have units coming from from far afield to participate in the exercise that was set to begin here at the end of the month. But we still will have units conducting training aboard the installation, and we're prepared to support that from the installation as long as the units are exercising the social distancing and medical protocols that we have dictated.
John Rivera mentioned it. He made a comment about the chow halls. So we're working on that right now. I've sent word out to the staff and COs. The biggest key is as the CG has reiterated numerous times, the biggest key to the social distancing, especially in a place like the chow hall, is education. And then adhering to it, taking it seriously. We have a number of young Marines that go to the chow hall that want to sit with each other and they want to talk, and it's an education thing and it's a leadership thing, to where we need leaders in the chow hall to reiterate to those Marines that, hey, social distancing is for a reason, and what that reason is for. It's not so they don't get sick. It's so the virus does not spread if one of those military members has the virus, and won't spread onto the installation.
Okay, good question here from Luis Del Toro, and he asked a question about he apparently has a family member, or he knows somebody that has a family member at home that has a compromised immune system or pre-existing conditions, yet they still have to come to work. So that's a really good question, and we addressed this yesterday with the commanders and alike. Is that if you live with somebody that's in that category, you need to discuss this with your chain of command and seek an exception to your work environment, because that is one of the key things we're worried about, is that either service members or essential civilians that are aboard the base that might have somebody at home that has a compromised immune system. So we're ready to grant special exception to those individuals. So you should seek that through your chain of command or your civilian supervisor.
So I see a question from Lee Flood Van Meter. Will PMO start further screening people at the main gate since Condor is closed? So yes, implementations have been given to the gate, specifically the visitor center there. So if somebody comes on and they do not have a DoD ID card, they will be sent to the visitor center, and those personnel that are coming on base will be screened, to be given access to the base. But that was implemented even prior to the closure of Condor Gate.
Okay, we have a number of questions dealing with haircuts and the barbers, and that's a really good question. So, first and foremost, at this point, the Marine Corps has not changed the standard for haircuts, right? And so I think so that's point number one. Point number two is, the way that most Marines have understand the standard and understand kind of the way we do things in the Marine Corps is that a Marine is expected to get a haircut every week. And a lot of units will also pass guidance that that haircut should happen on the weekend, so that when that individual shows up to work on Monday, that you're looking squared away, and you're not only within standards, that you're extra squared away on Monday. And that's kind of the way that we have grown up. And I've been a Marine for almost 36 years now, and I've been doing that. I've been doing that my whole career. My whole life as a Marine. As the discussions I've had with the commanders here over the last couple of days, is that that's not going to be sustainable in the environment we're in. So we're working with the commands that we're gonna go to kind of a haircut every 2 weeks type of thing, and then establish a schedule so we can maintain the cleanliness standards at the exchanges and at the barbershops, to be able to cycle folks through, but do it in a way that that we can maintain the health standard along the way. The other thing that might, it might sound simple to you and folks out there about, hey, the CG should just close all the barbershops. And the concern I have is that if we do something like that, then we essentially are just pushing the haircuts into the barracks and into people's homes and things like that. Then we have individuals given haircuts that aren't exercising any sort of cleanliness protocols and things like that, and we might actually make the problem worse. So we're going to watch this. We're going to watch this really carefully. We're going to work with the commands to make sure we can do this in a way that it's executable. We can maintain standards and then prevent the transmission of disease and protect our population.
Okay, Tiffany Darvin has a question about the PFT, if it will be extended or exempt. So that's not a decision for us to make. That's going to be a higher headquarters decision if they're going to run exemptions for PFT. I understand your concern. Really the only concern would be the crunch part of it, because that's the only time you would really come in contact with someone. Because you can pass someone when you're running with a 6 foot distance. But that's not a decision for us to make. That would be a higher headquarters decision.
Okay. A lot of these questions, a lot of these we've already answered. I'm just trying to find one that we haven't already addressed here, so apologize for having to scroll through here. So, I saw a number of questions have been talking about the real ID requirement. So that's another good question that we'll take away. We have established a need to have the real ID, and whether or not folks have the ability to do that during this time. I want to take that away to address that with my team and see if we can pass guidance on that. So go ahead, Sergeant.
So I see here, Lee Flood, Van Meter, all the outdoor work centers are open. So if there's the outdoor work centers, you can PT on them. However, the hit boxes that are along with those will not be opened, and that's strictly for sanitary reasons. There's no, we don't have the personnel. We really can't ensure that the sanitary is there. But if you want to go, use the ropes, use the pull-up bars, use the by the West Gym, the outdoor facility there, that is fine. I also noticed a questionnaire as the commanding general was scrolling through about what do we consider a bona fide guest. So that will be determined by chain of command. But a bona fide guest, the perfect example is what the CG said in his letter. If a family just had a newborn and they're bringing mom to mom or grandma or whoever to sit with the baby and the mom, right after the birth, that's bona fide. Or to take care of a family member that's sick, other than COVID, that's bona fide. But that's going to be a case by case for visitors. But what we don't need is just people coming up here to visit, your friend in the barracks or your friend at the house, because you just you want to get away from the whatever you want to get away from. So that's going to be a case by case thing. But they will be screened at the visitor center for them.
Somebody asked a question about cases that we know, and whether or not we know what's going on out in town and things like that. So we're closely watching all that stuff, because as we look at kind of the hot zones of areas where that community, that person-to-person transmission is taking place. So we're carefully watching that, our public health staff, and we're providing that information to commanders, so that if a commander is going to approve, say, a necessary trip for a service member to be able to go do something that they have to do, we want them to be informed by those areas that have heavy emphasis on person-to-person transmission, and that if you're going to go into one of those areas, you need to be extra careful and just assume that everybody that you're coming in contact, is potentially infected. So we're going to be providing that information, but we have access to databases and the like that not only talk about, say, a case that might exist in, say, San Bernardino County. That's not very helpful because San Bernardino County is like the size of North Carolina, right? So, 2 or 3 or 5 cases in San Bernardino County is not very helpful. But if we can talk about specifics about where the cases are and inform people of that, we see that as our duty to be able to protect the force and protect each other. Talk about limiting, just the limiting of patrons and things like that. I mean, most of that's already going on.
Yes, sir. Yes, sir.
All right, I'll cover that up. But there's a number of questions here talking about the exchanges and the commissary, limiting people, and most of that we're already doing. So I think this is Kristen Edwards asking this question about doing this, and so we are we're already doing that. Just being in the commissary and exchange myself this weekend, just kind of watching people and really maintaining the social distancing and things like that. The exchange, those activities are limiting people. So if they do limit you from coming in, I would just ask you all not to stand in a group outside, because that's part of the problem. That obviously defeats the purpose. If there's a queue or something out there, and now we've got everybody packed in, then you introduce yourself into the activity. So work together, stay cooperative, stay dispersed. The activities will invite in people based on that. And once you're in there, just making sure you exercise that. So if somebody is in the way and they're blocking the aisle, then you kind of need to wait until you just proceed by them. So just don't go through and start crowding each other just because somebody has kind of created a logjam in the process. So you kind of got to just be patient, maintain your social distancing, and then if we do that, I think we're going to be able to keep these activities open, and we're going to be able to ensure people have the supplies they need and and they can get the services they need without creating a problem spreading the disease.
So CG's already covered the haircuts, but the Navy put an admin out there that they're relaxing their grooming standards, so they will not be. We have no jurisdiction over them once the Navy puts a Navy admin out, reducing or relaxing their grooming standards. So no, we will not be. They don't fall under our preview.
All right. So let me. We're just going to go with a couple more here, and then we're going to take off out of here again. We'll come back to all this and answer anything, because this is really valuable feedback as we had discussed. I think most of these we've already covered. Yeah, there's a couple of questions that have come up about extending the chow hall hours. I'm seeing one now from Rachel Roberts about that, and I've seen that a couple of times pop. That's something we haven't looked at yet. And so first of all, we're having to exercise certain procedures in the chow halls to maintain social distancing. So a number of things have already been implemented in the chow halls, and then our chow halls are also postured to produce take-home meals if we have to quarantine folks, and in fact there are folks that are in isolation now aboard the installation precautionary that are being provided boxed lunches. So the chow halls are geared up to be able to do that in the event that we have a large group that might require isolation or quarantine. But the extended hours piece we haven't looked at yet, but that's a good suggestion, and a number of people have brought that up. So I'm going to circle back with my team and see if that's something that we can do, and we might also solicit from the commands, which chow halls are most important, and where are the folks that are working shift work and alike that might need that. So I'm going to take that away, and we'll come back to you on that. But that's a great suggestion as well. Why don't you go ahead and close up?
One more. You want me to close up?
Sure. If you're ready.
I got one more. So I see there's been a few out there talking about how can we improve or educate the Marines more on social distancing. So PMO will be going around reminding Marines now and sailors about social distancing, reminding them via loudspeaker, like, hey, we need to be social distancing or something like that. And they can also give them a citation, and they will be on the report that their command gives. Now, that's not like a driving citation or anything like that, but that's just making the commands aware that Sergeant Major Mueller was not following the directions from the CDC, the federal government, or the commanding general of the base, that he's not abiding by those rules. So PMO will be reminding them. The senior enlisted and officers will be reminding them. Those junior NCOs will be reminding them. So I got two things that I would like to close out with. Everyone needs to remember that it's our job, Marines' job, to restore restore peace in a time of chaos. And right now, the whole world is in a time of chaos. I mean, I've never seen anything like this in my lifetime. So we are in a time of chaos, and it's our job. It's our job to restore the peace. So if we maintain calm and do what we're supposed to do, we'll get through this. And then we have a no-fail mission to defeat this enemy, and this is an enemy. It is an enemy, and we have a no-fail mission to defeat it. And we need to remain adaptable, versatile, and flexible to keep up with the fast-paced changes that are coming. Semper Fi, Marines, sailors.
All right, yeah, thank you, Sergeant Major. Hey, we're just to close out here. So again, we're gonna follow this closely, both nationally, internationally, and locally, and we're gonna be as transparent as we can be. We're not hiding anything from you. We're giving you the truth. Just like the Sergeant Major said, and our ability to break the cycle is going to be based on our ability to execute these protocols and then sustain it over time, right? If we don't, if we only do this for a couple of hours or a couple of weeks, then it's going to be difficult. We're going to have to maintain these strict protocols over the course of weeks in order to break the cycle, right? And that's really where we are. And so we need everybody focused on this. I just ask you all, I mean, the cooperation we've seen on base has been great, and everybody's efforts have been good. We just need to continue to work together here. And I just say, challenge each other, right? Like, hey, you're not really maintaining the right dispersion. I saw you touch a desk and then touch your face, so now you need to wash. I mean, just kind of policing each other and really kind of holding each other accountable. We're going to be able to maintain our readiness, and we're going to be able to take care of each other, and we're going to be able to get through this crisis together. So we're going to be on it. We'll continue to post updates every day. If we have any changes, or if there's no changes, we'll sustain. We may take a day or so that we don't provide it. But keep after our social media sites. We'll make sure we keep everybody informed. And so thanks for what you've done so far, and we'll get through this together. So thank you very much.